Hello, this is Dr. White, and today I'm going to be discussing influenza. So a description of influenza or the flu is it's a contagious viral infection that can cause mild to severe symptoms and life-threatening complications, including death, even in healthy children and adults. Influenza viruses spread mainly from one individual to another through coughing or sneezing. Less often, they can also be spread through touching a contaminated surface and then touching the mouth, eyes, or nose. Individuals can pass flu on to others even before their own symptoms start and for a week or more after the symptoms begin. Risk factors for influenza or flu are age, living or working conditions, a weakened immune system, chronic illnesses, race, aspirin use under the age of 19, pregnancy, and obesity. So assessment findings. At first, the flu may seem like a common cold with a runny nose, sneezing, and sore throat, but colds usually develop slowly, whereas flu tends to come on suddenly. Although a cold can be a bother, you usually feel much worse with the flu. Common signs and symptoms of the flu include fever, aching muscles, chills and sweats, headache, dry, persistent cough, inconsistent, shortness of breath, tiredness and weakness, runny or stuffy nose, sore throat, eye pain, vomiting and diarrhea, but that's usually more common in children than adults. Diagnostic methods for the flu, the most common are called the RIDTs, or Rapid Influenza Diagnostic Test. Those work by detecting the parts of the virus or the antigens that stimulate an immune response. So these tests can provide response results usually within 10 to 15 minutes, but they're not as accurate as other flu tests. So you can actually still have the flu even though your rapid test result is negative. Other flu tests are called rapid molecular assays that detect genetic material of the actual virus. So those produce results in 15 to 20 minutes, and they are more accurate than the RIDTs. So treatment. An annual flu vaccine is the best way to prevent the flu. Antiviral drugs are not a substitute for annual flu vaccinations. However, prescription antiviral medications serve as an additional line of defense. The CDC recommends that all individuals who are hospitalized, severely ill, or at a high risk for developing serious flu complications should be treated with the antiviral drug immediately if flu is suspected. Treatment of the flu with antiviral drugs can reduce the influenza symptoms, shorten the duration of the illness by 1 to 2 days, and can prevent serious complications like pneumonia. Antivirals work best when taken within 48 hours of getting sick, but they still might be beneficial when given later in the course of illness.